Hello, class, and welcome to the final lecture of 4401, Being American, Part 2. It has been a pleasure so far to have read all of your papers in this class, and I look forward to reading what remains. And just so you know what this lecture is going to cover, really think of it as, on the one hand, sort of a primer or a refresher, really, of a lot of concepts developed throughout the semester. And on the other hand, I will try to show how all of these, at least in my mind, build on each other and sort of fit together. Really, what I want you to take out of this class is a lot of the things that I think are central to being, I think, a culturally conscious and critically thinking individual, essentially. At least in terms of what it means to be an American, really. And at the end of the day, that really is the point of the class. You're supposed to walk out of here just being, I guess, more conscious is the goal. And hopefully that's been conveyed throughout the semester. We have covered a very broad range of topics here, but as I hopefully have communicated to you, each of these also is, in some capacity, interrelated to each other. They're intersectional. I'm going to basically review some of the concepts and terms we've utilized throughout the semester. This won't be exhaustive because I don't want to bore you. You've done the material, you are very familiar with it. But I think it's useful to go back and just recap what we have talked about and see the larger picture and how all of these little pieces fit together. So, for example, in the first week of class even, we talked about what culture means to an anthropologist. And I gave you two different definitions of what culture is. The first was more at the macro level. It's what basically ties us all together. It's that community, that social context that we build together and reciprocates and reify on a daily basis. This is tied to the second definition of culture, that it's something in your head. It's something that you create on a daily basis and also something that you perform. This leads to gender as a performance and biological sex. Remember, anthropology and increasingly other disciplines have a separation between what we would call biological sex, basically your biology, and how that is distinct or can be distinct from your perceived as well as performed gender identity. So, in my case, I am a cisgendered male, meaning my biological sex is male and my gender corresponds with what is expected in society, that I am a man. That's my gender. However, it does not need to be. You can be a biological male but identify as a woman. That's your gender identity. It has no bearing on your biological sex. Remember, the biological sex, you can even think of it as the coat rack in which you hang the coat on, the coat being your gender. In a similar light, sexuality is not as black and white as a lot of people in the United States, at least, would think it. You can be pansexual, you can be asexual, you can be heterosexual, you can be homosexual. These are just terms that we utilize, and in fact, you can think of it as a spectrum of sexuality, going back to the Kingsley model very early on in the semester. Because sexuality can be seen as being on a spectrum, you may not identify as a certain sexual orientation throughout your life. You may change your sexual orientation because it's built on a combination of your biology and also your gender identity, what you find attractive, and what you maybe do not find attractive. These different combinations of factors, your gender, your biological sex, and your sexuality, are culturally mediated, and there is a biological component, at least in terms of your biological sex. But that cultural mediation looks different depending on what culture you're looking at, and even within the culture. What is considered to be maybe masculine in, let's say, Tampa Bay, Florida, may be very different from what's considered to be masculine in a rural area in Alaska. Neither of these are right, neither of these are wrong. These are just expressions of humanity, essentially. So those were sort of the building blocks for the class, but I also talked about inequalities at great length in this class. In fact, I would probably say this class is about inequalities and how these are shaped by our positionality and intersectionality. So I will go into those in more detail, but bear with me and I hope you all are doing well. My cat is on the keyboard and I cannot click the stop button. Thank you, Tipsy. Hold on. There we go. Remember, race, like gender, is a social construct. We build it together, but those building blocks are also largely shaped by our history too. So as a reminder, in the United States at least, for a while, what was considered to be white did not encompass being Italian or being Irish. These groups were discriminated against because they were perceived as less than, let's say, Europeans from Great Britain. This is interesting, of course, because we live in the supposed land of the free where everyone's on the same playing field. But since the inception of the country, that never really has been a reality. Our Constitution even afforded certain rights to whites that did not afford explicitly to black individuals in the United States. It wasn't until later, when we're having later amendments and bills added to our overall system of governance, that the racial categories became more blurred, at least in policy. In reality, racial distinctions largely shape social interactions in the United States, whether explicitly, let's say overt racism, or implicitly, implicit bias, as an example, in the workforce. Remember when I talked about a while ago, I even showed a video of a professor who, he was a black American, that's what he identifies as. He would call different hotel and land-owning establishments and ask, hey, could I rent a room here? And he would put on what he considers to be a more stereotypical African-American voice. Then he would call the same place later on with a more stereotypically white voice. What do you think the results were? Well, when he put on this, in his perception to be a white voice, he got more callbacks and he got more offers that yes, you can stay here, you can pay rent. Even though the African American or black voice he was putting on, the implication was he would also pay rent. But the landowner's implicit bias towards receiving, at least, that, as an example, maybe the white person that was calling him could afford the place, or he just overtly maybe was racist towards blacks, this shaped his ability to, let's say, find housing. This is just an example, but you can think about this also in the workforce. So some jobs are stereotypically seen to be that of black males or white males. Now let's tie in gender to this. I showed another video where a black woman sued a company saying that you're disproportionately not hiring women of color. The company said, we have an equal amount of women and men. However, when you broke that down by demographics, what was proven in the court was that certain women, let's say white women, had certain jobs, let's say being secretaries or being receptionists. Black women were not able to get those same jobs, so they had a less opportunity. They were being discriminated against based on not just their gender, by, let's say, having the potential pool of jobs they could apply to. They were also being discriminated against based on their ethnicity, their race. Again, sectioning off a certain section of the overall job pool that they were not allowed to enter because the jobs that they were applying for were going to white women instead. So you can't separate race and ethnicity and gender when you're talking about issues in American society, because race, ethnicity, gender, these all combine and compound with each other intersectionally to shape people's life histories, their life course moving into the future, and also their health, which is the next slide. So race is a social construct. So that means it doesn't exist, right? No, at least according to anthropologists. or I should say most anthropologists. Clarence Gravely mentioned early on in the semester, in the reading I assigned you, that you can think of race as the socio-cultural reality that we make, which has biological consequences for racially defined groups. I have italicized racially defined because that really is the key term here. In the US, we have rigid categories of this is a Black American, this is a Chinese American, this is an Irish American. These categories are unique to the United States because in other countries, remember I showed you in Brazil how there is a wide range of categories that cascade in and out of what we would consider to be black in the United States. This is going to have a large role in how we conceptualize individuals, our expectations of individuals, and how we interact with individuals. So, race is not a biological reality, it's a sociocultural reality that has biological consequences. Let's say, for instance, you are a doctor. This ties into number 2 here that I have. And in your perception, in your mind, Black men are more resilient. They have tougher bodies than white men. This has been shown in the literature that a lot of doctors actually have this perception, even though it's not based on reality. So I'm not going to prescribe to you as a doctor pain medication because I think that you're faking it just because you want to get high off the medication. So now the Black patient in this example, he goes home dealing with chronic pain that is not being addressed because the doctor perceived that he didn't need the medication. He's fine, he's faking the pain. Now let's say a white male came in complaining of, let's say, back pain. The doctor is more inclined, at least statistically, in the literature, to prescribe him medication. So this white male goes home with his medication. He's treating his underlying chronic condition. So his wellness, which I'll get into in the next slide, is higher than that of the Black male, just at least in the context of his chronic pain. So researchers play a large role in reifying disparities in health for different, again, racially defined groups. As number 2 says, epidemiological evidence for racial inequalities in health reinforces public understanding of race as biology. Excuse me. This shapes the questions researchers ask and the ways they interpret the data, which also reinforce a racial view of biology. So if I'm saying that African Americans or Black Americans are at higher risk for heart conditions, I may be reifying the perception that there's something about the biology of Black males or Black men that make them more risk or at risk for heart conditions. When in reality, it may be better to say that individuals living in certain contexts, let's say in low economic status areas in a food desert or a food swamp, are at higher risk for heart complications because of their environment, which shapes their health potentials. Because I didn't say that, and I just said Black Americans or Black males, I'm reifying the perception that this racially defined group of Black males or Black men are at higher risk for complications. In a sense, I'm practicing, without even thinking about it, racial determinism, which is this perception that there's something biologically inferior about the Black body, when in reality it's that their environment is shaping their biological reality. If health is biocultural, what does that really mean? Some scholars, including within anthropology, say the biocultural model is so broad and expansive, it kind of is a stopping point because basically everything impacts everything, so what do we do with that information? So breaking this down into what's called a construct, basically a construct is the thing that is a building block to get to a theory. So in the biocultural theory, because it is really a theory, 2 key components are present, at least for a medical anthropologist. Those are the construct of health and the construct of wellness. You can think of health as the biological state of being healthy or unhealthy. This basically is what a doctor would write on your medical charts. Let's say he diagnoses you with coronavirus. You are now in the unhealthy category because you now have this medical condition. I'm going to refine this because coronavirus, as you probably know, just from in this current context, can sometimes or often actually be asymptomatic, meaning that I could have the disease right now and have no idea. So in that sense, my health hasn't really been impacted by the condition. Let's say I have relatively mild symptoms from coronavirus. My health is going to be slightly impacted based on my expected norm because of this disease. Let's say that I'm getting the very acute, very severe consequences of being infected with coronavirus and I'm having to go to the hospital. My health is going to be very much impacted because of this disease. All of those aspects are also tied to wellness, and wellness basically is a person's experience with being unhealthy or unhealthy. How do I deal with having mild coronavirus symptoms? How do I deal with having very severe symptoms? Wellness is, like health, shaped by your environment and your positionality. Let's say you are relatively poor and you are afraid that the cost of getting treated for coronavirus or testing for coronavirus would be very high for you, and that economic burden is too much for your family to bear. So you're just basically going to weather the storm and hope that you come out the other end being relatively healthy. Your wellness is going to be impacted by that because you're not treating the biological condition of having coronavirus. So your subjective experience with coronavirus is going to be different from someone else who maybe can't afford to get treatment for the disease. This is all tied to embodiment. Basically, how do we combine the health and wellness that we have and internalize it based on our social and biological environment? You can think of the biological environment as literally your body. Your body is an environment. And that environment interacts with the external environments of your surroundings that can be both social in the sense of, let's say, your family, or it could be social in the sense of the workforce that you are currently employed in, or it could be social in the context of, let's say, you're experiencing racism. These environments shape your health, which in turn shapes your wellness. So you can't separate these terms. It may seem like a messy model, but basically it's just saying that your physical environment, your social environment, has an impact on your health, but also has an impact on your subjective experience of being healthy or unhealthy. Interestingly, in terms of coronavirus, a lot of work is starting to be produced on the mental health burden of coronavirus. We've all been cooped up in our houses for roughly a month and a half to 2 months at this point. And some researchers in psychology that are producing scholarship right now are saying that we basically all are experiencing a national trauma or even global trauma in the case of looking at different countries. This trauma may have long-term consequences on our overall mental health. Taking the example of being, let's say, deemed a non-essential worker. Let's say you were laid off from your employment. Your economic status is going to be lowered, and because of the economic uncertainty, there may be consequences concerning your perceptions, your wellness of your overall state of being healthy or unhealthy. So we can't just think about the biological condition of coronavirus. It also is how coronavirus is, in a sense, a social and economic condition, because it has impacts on all of those. We're practicing social distancing, key term there, social, because of coronavirus, so it is shaping how we interact with each other. That context is also having a large impact on our economics, so who can go to work, who should go to work, who is being exposed to what because they do have to go to work, who is staying cooped up inside their house because they are of a weakened immune system and it is not safe for them to be out in the general public. All of these aspects are prime examples of how health is biocultural, but also how you can't separate culture, society, economics, politics from your overall health and well-being. I told myself I would not harp on coronavirus today because I did so on Monday, but it's so topical and so important that we get this that I am doing it again. To get at least slightly more on track, because I could easily slip down a coronavirus tangent, I want you to leave this classroom, if anything, with these two terms. That's structural violence and symbolic violence, and how they both contribute to health disparities. These are important terms because they really are the foundation for a lot of the disparities, health or otherwise, that Americans face, or maybe even exacerbate, make worse. And of course, they often interact with each other. This is an older slide, but I'm returning to it, I'm revisiting it because I really think that the examples here are probably more clear-cut. I've been using black males as an example here, but just to diverge for the sake of diverging, I'm going to say, or take into consideration, let's say, the experiences of Latinx women. Latinx women, which again is a very broad term and is not all-encompassing, even though it tries to be, experience incarceration at higher rates than white women do. And again, white women itself is a social construct. It's a racially defined category that we give credence to, but doesn't really reflect any sort of reality in the sense that these are white males and these are black males, or these are white women and these are Latinx women. So, if Latinx women experience incarceration as a form of structural violence, which again is the policies and systems in place that can contribute to health disparities, more than white women, this is going to impact their health and their ability to navigate society in the US. A contributor to incarceration is symbolic violence. So let's say the perceptions that police officers have concerning who is a drug addict or who is more violent. If they have these perceptions walking in, these stereotypes essentially, they may incarcerate at a higher rate Latinx women as opposed to white women. So the built-in racism that they, for instance, may have, or maybe the policies that they have to use, let's say stop and frisk policies in New York that they have to have or have to use, these come together to increase the rate of incarceration for Latinx women. Let's say this Latinx woman, as an example, is also pregnant. Her higher rate of experiencing incarceration as a form of structural and symbolic violence can have an impact on her maternal outcomes. Let's say she's later on in her pregnancy, let's say in her second trimester, and the stress she's experiencing from, let's say, working at a low-wage job or experiencing racism, or both in a lot of cases, and then she gets incarcerated. That extra stress she just got may be a risk factor for her having an early term birth or a low weight birth. Both of these conditions, for the infant, let's say, can have long lasting cascading consequences for that infant's life course. So from the point that they are a fetus in the womb all the way until their death, let's say of old age even. That experience in the womb has incredible ability to shape your overall health. You are very what's called elastic when you are a fetus. The environment of the womb is going to impact basically your entire life. It's going to impact your biological outcomes, to go back to the Gravely model, essentially. So the racism, the stress, the structural violence that your mother faces impacts the environment of the womb. And that environment of the womb impacts your biology and your biological outcomes. Now, let's say that this infant is born and they are growing up, let's say, in a low economic status household that has limited access to nutritious foods. Because of the stress that their mother experienced and, in a sense, passed on to the biology of the infant, that infant now is at risk for a variety of chronic conditions, due to that stress that her mother experienced. Now, let's say that she's eating a relatively poor nutrient diet. That diet may increase her likelihood of developing obesity, type 2 diabetes, or maybe even heart consequences decades from the point when she was an infant or a toddler, essentially. So let's speed up the process of this baby's growth. Let's say that the biological female, the mother that birthed the infant, she's now a grandmother, and the child that she birthed is now an adult. That adult now becomes pregnant. The experiences of her mother that were imparted into her biology when she was a fetus, and then the experience of that fetus developing into a toddler, into an adolescent, into adult, experiencing food insecurity and stress due to racism and other complications, is going to impact their fetus if they get pregnant, their infant, their child, that eventually becomes an adult. So it becomes a circle of health disparities because of the experiences of the grandmother, of the mother, and then of the child. So you can't really separate symbolic and structural violence from biology. They compound and have long-term consequences that maybe we don't even see when it is happening on the local level. I've shown this slide before, but I think it's very important to contextualize what we're seeing today, even with coronavirus, in this context. So again, do you notice anything missing? As you pointed out in class, two things that really come to mind when you see this photo is that A, there's no women, or at least those that are identifying as women. We're assuming based on how they're dressed in the usual attire we consider to be a man's attire. There also is no persons of color here, at least as far as you can see in this photo. You're seeing a lot of older white men or white males that likely are cisgendered, just statistically. These are politicians. These are politicians making health policy. In this specific photo, they're making health policy about women's sexual and reproductive health. There's no women at this table. So the experiences of white men, what they think is a problem, may be very, very different or diverge to a large degree from what a room full of women would consider to be health problems for women or biological females. In 2016, women only accounted for 23% of government offices, despite being slightly above men in terms of population statistics. So if only a quarter of government offices are occupied by males, what effect does that have on the policies that are developed? Taking race into consideration, the majority of policymakers are white males. So what is being missed that if we don't have any persons of color that bring a different positionality based on their intersectional identity and experiences to the table? This is why equity in policy is so important, because let's say a lot of these individuals probably come from affluent backgrounds. I'm making an assumption here, but that assumption is also based on statistics. If you have a bunch of affluent white males making policies that largely affect those that are most vulnerable, those, let's say, of low economic status, or those in minority groups that are classically discriminated against, do these policies help? Do they reflect reality? Or do they reflect the reality that the politicians want, or they perceive should happen, essentially? So keep that in mind. And in terms of coronavirus, remember that areas most hit by this disease, or at least are most impacted, seem to be among minority groups. If health policy does not actively address that, this health disparity is going to become exacerbated, and the already wide gap between health outcomes for the general white population and the general minority population will end up being exacerbated. Taking economics into consideration also, as let's say low-wage workers are not able to go to work, let's say they're not deemed to be an essential worker, their ability to pay for themselves or their family is going to be very much impacted by this, as opposed to policymakers who get health insurance as a package despite not giving it to others because they say that You need to earn your health, essentially. So keep that in mind when you are hearing discussions of, this is too costly, we can't afford to give you a monthly stimulus package, for instance. Some of you may already have gotten your $1,200 or more if you have children. Is that money sufficient? It definitely helps, but is it sufficient to address your needs right now? Think about that. These discussions all fall within the biopower theory that the French philosopher Michel Foucault proposed decades ago at this point. If you remember, biopower basically is the state's capacity and want to control your biology. I mentioned this on Monday's lecture also concerning incarceration. But it of course also applies to reproductive potentials, abortion access as an example. So Lynn Morgan and Elizabeth Roberts, two anthropologists that I've mentioned before, they developed a term building off of biopower called reproductive governance, which is the mechanisms through which different historical configurations of actors, such as the state, use legislative controls, economic inducements, moral injunctions, direct coercion, and ethical incitements to produce, monitor, and control reproductive behaviors and population practices. We're not hearing much about abortion right now. That being said, abortion policy continues to erode the ability for women and families, biological females, to be able to access an abortion. So coronavirus, of course, is a pressing issue right now, but there are other issues of concern, and hopefully coronavirus, when and if it is addressed and is no longer at least an immediate issue, an acute issue for us. Think about other issues that may be in your peripheral. You didn't really care about them because you didn't think they directly impact you. Coronavirus may not directly impact you, but it impacts others to a large degree. This also applies to abortion access as an example. So I'm sure you can tell from the way I talked about it this semester, the science of abortion policy demonstrates that access to abortion services legally decreases maternal complications and deaths in the country. The inverse of that means if it is hard to access an abortion, you're going to see more maternal deaths and maternal morbidity as women are going to seek this service clandestinely or illegally. As my researchers, or those that I do research with, often say, women are going to get an abortion if they want it, legally or otherwise. So to have a policy in place that seeks to control their ability to get that service only makes the service hard to access and more dangerous for those that actually want or need an abortion. So, again, think about what you are hearing concerning politicians talking about abortion. Their reasoning behind, let's say, restricting abortion services. They often couch it in terms of it's not safe. Abortion access, actually, if it is available for women, is a pretty safe procedure in the literature, in the science. But then you will see politicians in certain states say that abortion clinics need to be X amount of miles from a hospital in case there is a complication. Complications due to abortion, if there are complications, usually are not that acute. They don't seek immediate medical needs inside of hospitals. This can happen, of course, but it's very rare. The likelihood of you getting harmed in another procedure actually is relatively higher. So again, keep that in mind when you're hearing people use the words that they are concerning health and safety and the good of public health. What is the science saying behind it? This actually is an interesting slide in the context of coronavirus right now, because we're currently seeing people use the language of human rights to argue that their rights are being infringed by being told they must stay indoors and that they can't work. That this is uniquely un-American to suggest people to do this. As has been found in international health and aid, human rights is a very squishy term in the sense that it can mean different things to different people. To someone that maybe is pro what's considered to be women's rights, they may consider it to be a human right to have access to abortion. However, it has been found that those on the so-called pro-life side also use human rights to say the fetus is a human, so they have rights. So human rights as a discourse can get really complicated. And it's important and is a good example of how words can be used by different people and operationalized with very different agendas. In this case, dichotomous agendas between those seeking abortion access and those seeking to reduce abortion access. In the context of protests right now concerning being able to go back to work, you've probably seen on social media those counter protesting. You'll see healthcare workers counter protesting those trying to go back to work and demonstrating. Maybe they're standing outside, they're in front of a protest with a mask on, standing there by themselves, or maybe they're blocking traffic of those that are trying to protest the current restrictions at home. So then you have to ask yourself, if healthcare workers are protesting or counter protesting what your position is your position based on science, or is your position based on some other thing, maybe social, that is influencing your perception of a very deadly, very serious disease, which can have cascading long-term consequences, including maybe even making us stay indoors for a longer period of time because people are outside demonstrating in large groups. I dabble in linguistic anthropology, so I want to harp again once more on the importance of words. I did so on the last slide, but think about this in terms of coronavirus also. On Monday, I talked about how saying it is the Chinese virus is A, inaccurate, and B, very problematic. But also think about how we are talking about the disease in terms of even, let's say, the global transmission. So, coronavirus in Wuhan, in that context, it was an emergent disease. Corona is not new, but it started spreading really rapidly. It is a good idea to think about why that may be the case. Diseases, because I study them, I can clearly see how they are social and biological and environmental and ecological and political. But sit down and just think about it. So supposedly this disease started, let's say, in a wet market where food is being openly traded, sold, and cooked and consumed. That itself is an economic context because there's commerce going there. Diseases often travel with commerce. They travel with trade. If a disease is in Wuhan, then someone in Wuhan goes to somewhere else in China, they can bring the disease with them. Let's say that a tourist from, picking a random country, Brazil, goes to this location where this person who was in Wuhan went. They then get the disease. They then bring it back to their country. That can be the start of a pandemic. Remember the distinction here between an epidemic and a pandemic. An epidemic basically is just a disease that is rapidly spreading over a geographic location, oftentimes conceptualized as within a country. But diseases do not obey borders. These are themselves social constructs. The border between China and a country right next to it is artificial. It's only there because we make it there. There's nothing that says that this has to be China, this has to be another country. When it does cross this border, health policymakers, let's say the World Health Organization, consider it to be a pandemic. That language of a pandemic for the World Health Organization, when they make that declaration that a disease is now a pandemic, let's say Zika or COVID-19, it could have already been a pandemic in the sense that the definition of the term is it's spreading internationally. But when they give it the classification of a pandemic, that's when they can start operationalizing resources to, let's say, test areas in different countries, or to provide government assistance for testing or the ability to, let's say, quarantine large amounts of people. So words matter in that sense too. When a disease is considered to be an endemic condition, meaning it's basically stagnant in a population, it's spreading for the foreseeable future with no end in sight, that's when we really start to think about how this is a social and environmental, ecological, and political condition. Because oftentimes what happens is, if a disease is considered to be endemic, politicians don't justify that it is economically viable to keep trying to address the condition. In the case of dengue fever, which is spread by mosquitoes, a lot of different countries have endemic dengue. It's just an expectation that dengue is prevalent, there'll be waves of dengue, and it'll always be like this unless something drastic is done to address it. And until that happens, you're going to probably become at least exposed to the risk for getting dengue fever. Hopefully, coronavirus does not get to that endemic state for us, because that would have disastrous complications and consequences for our country and elsewhere. But that term endemic carries a lot of weight in health policy intervention making. So keep that in mind. The last component here, which usually stems from an endemic declaration, is when a disease is considered to be neglected. The term neglected is used to indicate that this disease is not being actively addressed. There is not an active need or want on the part of policymakers or public health specialists to make a drastic intervention concerning this condition. So when a disease is endemic, it's actively spreading, you might, let's say, do sporadic fumigation to make sure that the populations of mosquitoes are not getting that drastic. However, you may justify that as not economically viable because there's going to be mosquitoes whether or not you spray, just less of them. So maybe we just shouldn't do anything and just the population should just bear the burden. This is tied to neoliberal economics also. Remember, neoliberalism basically is a policy philosophy that we should basically let the free market, so let individuals figure it out by getting good jobs, by educating themselves, by making money. Then they can pay for their services. The government doesn't have to. So there really is no need to go around and fumigate in this case, because individuals will take care of their own health. This is a flawed model, of course. I say that, but that also is our model. People should take care of themselves. People should wear masks. Not saying they shouldn't wear masks, but people should wear masks. People should wash their hands. People should stay indoors. But you're also saying that you need to be able to afford health insurance. You need to be able to afford for your family. If you don't, you're being irresponsible. You didn't accrue enough money. You didn't have enough savings. But when people are living hand to mouth, they can't really do that effectively. Most Americans don't have $1,000 in their bank account. They don't have a windfall to prepare for, let's say, a global pandemic that prevents them from going to work, or maybe even is a facilitator for them losing their job. This is tied to inequalities, like everything else that I talk about basically in this class. Those that are the so-called essential workers, those are the most vulnerable people for an epidemic or a pandemic such as coronavirus. This highlights, toward anthropologists at least, a need to address the underlying disparities that puts people in positions where they are essential workers, where they can't afford to not work, essentially. So words can have a lot of power, because saying things like personal responsibility, or you should do this, you should get a good job, you should be responsible, they can have an impact on health and can shape health disparities. Health disparities don't need to exist. They exist because we allow them to exist. We perpetuate them. When going through one of your readings again for this week, I was struck by the passage near the very end that says, while the government works to address the challenges at the U.S. border, the country should also ask itself if it makes sense to continue to prosecute and detain large numbers of unaccompanied minors in order to ensure their safety. In parentheses, I probably should say supposedly. Think about that passage, and think about this passage here that I was reading today from the Milwaukee Independent. Doctors are concerned the spread of coronavirus in the U.S.'s prison-like immigration detention centers is inevitable and will hit a system blighted by overcrowding and medical negligence. Actually, if you were to Google, for instance, coronavirus detainees, you'll be seeing articles that say that federal judges are urging ICE, those that basically round up suspected immigration violators, essentially, to lessen their sort of draconic policies right now concerning rounding up people and bringing them to these detention centers for processing and most likely deportation. Because these contexts are, in a sense, very high-risk areas. They're breeding grounds for different health consequences and issues. You may remember seeing in the news, in the media, and also from this reading, that there often is a lack of access to basic hygiene resources. Soap to wash your hands, toothbrushes, toothpaste to maintain good oral hygiene. All of those factors, which are pretty small, soap, toothpaste, can drastically increase the risk for spreading coronavirus if you do not have those basic essentials. Now think about the conditions of these detention centers that you may see in the news media. Large, very cramped spaces from people rounded up from different locations, most likely providing very much, quote unquote, necessary worker jobs to our economics. But from very different contexts. Let's say a large county, Hillsborough County, for instance. You're bringing them all together, you're locking them in a small room for a long period of time. You're not providing them the resources to take care of themselves. What's going to happen? Eventually, we're going to have a situation where there's going to be a large outbreak in one of these detention centers. In fact, there's already been infections in detention centers that have been identified. So, what can we do? What should we do? It starts to get into maybe the more advocacy side of anthropology, or the applied side of anthropology at least, where right now, for whatever reason, we largely have a lot of apathy. I don't mean to say that none of you care about the detention centers and those that are inside these detention centers. However, we're not, let's say, going out in the streets. Well, we shouldn't right now anyways because of coronavirus, but we weren't before either in large numbers. Why not? There's this perception that it's in the periphery. It doesn't affect us, so it's not in our backyard, essentially, is a mentality that a lot of Americans have. For whatever reason, that mentality of it's not in my backyard influences a lot of different aspects of our daily lives, our interactions with each other. It doesn't concern us because it's not us. However, we supposedly live in a, as people often say, a melting pot of cultural diversity in the United States. Do we? Or is it more, there are rigid, again, racial boundaries that we separate, that make them the other and make us us? What can we do? What should we do in this context? Because right now, policymakers are not doing enough, at least in my opinion, and in the opinion of other anthropologists at large. The more I have lectured today, the more I realized that today I really made a linguistic anthropology presentation. Because, again, the words we use matter. And just because someone says something and they're in a position of authority does not make that fact. It could be an opinion, not based on the science. This often is seen and has been demonstrated to happen in terms of talking about immigration and migration or migrant workers. So I have this article along with the coastal erosion piece at the end of the semester because they identify problems. They also are a call to action to find solutions. What can we do? As the reading says, insisting that child migrants return to their families ignores the fact that the families of many of these young people are in fact already in the United States. What often happens with the US-Mexico border is that families don't come here all at once, despite supposed caravans of migrants entering the border. What often happens is they have to save up enough money to pay basically what's called a coyote, which is a colloquial term basically for a smuggler on the U.S. border, to be able to basically purchase a informal ticket of sorts to be able to cross the border. That could be very expensive. It can lead to a lot of coercion. It can lead to a lot of rape. It can lead to a lot of robbery and murder. But that's what they have to face if they want to enter the U.S. border. Another facet of this also that makes the supposed open border that we need a wall around supposedly is that what ends up happening is we are basically creating funnels or channels for people to try to cross the border illegally. These funnels or channels often are in the most dangerous places on the US border with Mexico. They're in the open deserts and savannas. They're in the mountain ranges that have no access to water and other resources. So there are plenty of deaths that happen that aren't recorded, that we don't see as Americans, that we basically blindly ignore because it's not on our back door. It's out there in the desert, even though it's technically our territory, that occur because of the immigration policies that we have in the United States. From a public health perspective, regardless of your stance of border security and border tightness, we are making people basically die because they are trying to get into our country. Is that the America that we're trying to build together? Just think about that for a second. Insisting that children return in these cases is often impossible because, let's say, the mother went and she was able to cross the border successfully. The father tried, but he ended up getting rounded up by ICE or border security and brought back to Mexico. Now he sent his son because he forwarded enough money to get his son across. So then he sends his son across. His son gets to the United States. His son lives in the United States for 10 years. Let's say his father disappears because of the violence he was experiencing in Mexico. And then ICE rounds up that child, finding out that he doesn't have any legal papers to be here. They say, well, we're going to send you back to your family. They don't even know where his father is, so they just send him back to Mexico. Imagine being 10 years old and being sent to Mexico and trying to figure out what you do in that situation. You may not even speak Spanish. So, structural violence and poverty at home, in this case, let's say Mexico or Guatemala or Honduras, which is a lot of different countries that bring or experience the sort of contexts that facilitate migration or immigration to the United States, have forced parents to migrate to the US in order to provide their children with food and clothing. Migration to the US border is often framed in terms of economics. Oh, they just want to make more money than they are making at home. That is a gross oversimplification of what actually is happening. They can't afford to eat. Yes, they need money. It's not because they necessarily want more money. It's because they need more money. They can't afford to provide for themselves and their family. We have this perception that people want to go to the United States because we're just an awesome country. People want freedom, whatever that actually means is subjective also. They just want to basically exploit what we have. Like we somehow are entitled to it because we were born here. When in reality, a lot of people probably would love to stay in their country of origin. They just can't for multiple reasons. It could be the violence they're experiencing, the persecution they're experiencing, the poverty they're experiencing. That leaves them no other option to basically other than to leave or die. This is something that we don't talk about enough in the United States. It's not something that I probably didn't engage with enough in this class. I've mentioned migration before earlier on, but in terms of structural violence, in terms of symbolic violence, racism that, let's say, Mexicans experienced during the 2016 election, that isn't engaged with enough. It's not our problem, supposedly, because it doesn't affect us, but it does affect us because individuals that meet these criteria, this racial identity or identification that we give them of, let's say, the Mexican migrant worker, they're the one providing food on the table right now in this case. Where if you're going to the grocery store, if you're buying vegetables, think about who is picking the vegetable right now. There are articles right now you can look up that show that a lot of migrant workers in this context are working in very horrible conditions that expose them to coronavirus potentially because they have no other option. And then we go to the grocery store, we go to Publix, and Publix doesn't even want to increase the cost of produce by 1 cent because that would supposedly impact people's perceptions of Publix is basically the place you go to if you want the customer experience. That 1 cent I mentioned because about a year and a half ago to 2 years ago, there was a push for Publix to increase the cost of their produce by that 1 cent. That 1 cent would go towards increasing the pay for migrant workers. Publix denied that. I say that, but I still go to Publix as my primary grocery store. Why? Because I don't think about that actively whenever I walk into the grocery store. As an American that likes to go get produce that is readily available, that a country may not have access to readily. Think of this last article that I'm assigning you the entire semester, so yay. As a reflection paper. He's musing on his role as an anthropologist, his role as a researcher, his role as an American, about a topic of concern to him, in this case, climate change and coastal erosion. However, he has some really poignant reflections here, which is, I think, one of the strengths of doing a reflection paper, reflecting on who you are, what you care about. The first one says, I knew about these changes, so in this case, coastal erosion, but I never had a bigger picture understanding of what was causing them, what people were doing about it, and why any of it mattered. Looking back, my view of the world was often pretty limited and short-sighted. I come from also a coastal town. This is me talking now, not him. And I remember very vividly examples of me hanging out with my father and fishing, and him mentioning that the water used to be at this level. He didn't conceptualize it as global warming or climate change. He just said that we're seeing a difference here. But if you take that understanding, that local understanding, which is why anthropology is so useful and so needed, because they have that ability to ask people these kind of questions, and you pan that out and you say, this is what is happening in Fort Pierce, Florida, but what is causing this? Looking back further, climate change, melting ice caps, isn't contributing to sea level rise. Something across the world is having an impact at the local level. And people are seeing that. They may not have the language to be able to articulate that I'm seeing climate change here. And it is because of corporations mass producing CO2 into the air, or mass agriculture, intensive farming with lots of cattle contributing to climate change and the erosion of the ozone layer. But they see it. Your job as the researcher is to say, this is what they're saying. Here are some reasons they may be thinking that. That's what an anthropologist does at its base. When you are talking with people about concerns to them, whether that's coronavirus, whether that's gender-based violence, whether that's coastal erosion, whether that's food insecurity, there are reasons those things happen that are social, environmental, ecological, political, and economic. So, your job is to parse that out, to critically think, because you're getting critical thinking skills. To be able to apply those is the next step of doing applied work, of doing an intervention, of making a positive change in your community of interest. As he says, this is part of the problem we face. So many of us tend to think and act on such a local, day-to-day scale that we cannot or simply refuse to recognize the large-scale processes that shape our lives. I wouldn't conceptualize this necessarily as a problem, but it can be a problem if we don't expand our thinking beyond the local level. A local perspective is why anthropology is so important, because we can get that very refined context. This is what is happening in Fort Pierce, Florida, concerning coastal erosion. This is what fishermen in Fort Pierce, Florida think about coastal erosion and how it has an impact on their life. What can we do, maybe at the policy level, maybe at the environmental level, or both, to address this concern? How do we create, let's say, a system for fishermen to adapt or be resilient to coastal erosion as they try to exploit local areas around the beaches to fish, for instance? That scale, going up and down to the micro to the macro level, is where anthropology really finds itself, doing probably the most important work that it can contribute to the discussion, what it brings to the table, essentially. When people are talking about something that you think is problematic, you have a responsibility as someone that has critical thinking skills you've developed in the course of your education to point out, for instance, why they may have that internal bias, why they may be practicing, let's say, microaggressions they may not explicitly be thinking about as a problem. Hopefully in this class, I've demonstrated how disparities are multifaceted. They are not necessarily the responsibility of individuals and their individual actions, but those individual actions and behaviors are shaped by their environment, both social and biological. Once you understand that, we can start to find ways to address it. You can move beyond assessing, let's say doing research for the sake of research, and move on to doing interventions or research for the sake of improving people's lives, improving what it means to be an American for you and others, hopefully. That's really it, folks. As it says on the screen, it was a pleasure to be your instructor this semester. I've enjoyed reading all of the materials that you have given me, and again, as I mentioned previously, I've enjoyed seeing your progression in terms of your writing, in terms of your reflexivity, in terms of your critical readings and understanding of the material over time as well. If you have any questions about the remaining due dates or assignment guidelines for the rest of this semester, you are quickly approaching the sort of final hour. So please reach out to me so that we can sort of get you settled and find a way that you can get these done. At the end of the day, just get it done, and that's sort of the motto even in graduate school. That being said, if you have any questions about possibly even going on to a graduate program, my experience, of course, is primarily within anthropology and public health, and that also means specifically with USF and University of Central Florida, or UCF, given my background, but there's a lot of similarities among the different institutions. So I can at least get you pointed in the right direction if you are interested. But whatever you decide to do after this class, and if this is the end of your semester and end of your time as an undergraduate, congratulations. And I hope that you all take some of at least the concepts developed throughout this course and maybe apply it to your own life, or maybe find ways to potentially address, let's say, a disparity that you see and recognize in your community or in a community of interest to yourself. So that's it, and I hope you all have a nice winter break, whatever that looks like in this COVID context. And hopefully I will get to see, potentially in person at some point, and talk to you all later.